Good morning, Audrey. Welcome.
Thank
Welcome
you.
everybody to the Rotary Club of New York luncheon meeting. Today is October 14th, 2021. We have a very exciting speaker, Alyna Smith from PICUM, who will be talking about migrant issues and COVID-19 vaccines and many other questions that may arise from that topic. So with that said, I let Audrey play our Star Spangled Banner as we always do. Thank you, Audrey. Thank you, Audrey. Thank you very much.
You're welcome.
Once again, I thank everybody who is on this Zoom call today for joining. It is now with great pleasure to introduce to you our President, Gerard Triffin.
Thank you, Andreas. Good afternoon, everyone, and thank you for being with us today. We have a very special guest today, Alyna Smith. We haven't discussed it yet, but she and I have a number of things in common. She's a licensed attorney, and she has a background in criminal law, amongst other kinds of law. And I was a prosecutor, both for the Attorney General's office and the DA's office, and currently sit on the bench as administrative law judge. So we have that background. And I also have a background in international law. Alyna is an advocacy officer of PICUM, which is an acronym, the Platform for International Cooperation and Undocumented Migrants. And I cannot think of a more apropos topic today than this one, since this literally affects, well, it's affecting the entire world. We certainly see it as a big issue in the European Union, and it has become a major issue here in the United States, just something else to further divide us, as if we did not have enough. I'm not going to discuss anymore. There's something I want to discuss later on at the end of the meeting. We have a number of people around the world and our sister clubs, both in Mexico, Europe, and Africa, and they may be tuning in to us today. And if not, they will see we're being recorded, so they'll have access to it later on this afternoon. So without any further ado, my pleasure, Alyna Smith. Please introduce yourself. It's our honor to have you with us today.
Thank you very much, Gerard, for the introduction. Thank you very much, Andreas, for the invitation to come today and to speak with all of you. We have another connection, Gerard. I was saying to Andreas that actually before moving to Brussels, we lived in New York for 7 years. Both my children are born in New York. So we have a very, very fond connection with that city. Yeah, so no, it's lovely to be with you today. I'm going to share some slides and tell you a bit about PICUM and our work. We work on a variety of different issues. And when we come to the discussion part, I'm happy to talk to you about any of those issues that are of interest to you, including broader issues related to the policy environment here and the situation of undocumented migrants. I should start before I launch my slides just by saying PICUM is based in Brussels in Belgium. And the majority of our membership is in the European Union, although we do have some members outside the European Union. So most of what I'll speak about is primarily about the European context, but I think there's a lot that will resonate with you. And certainly we also work in a global context. We have a lot of partners in the United States, and we're familiar with the issues that, at least on a broad scale, that you're confronting. So I will share my screen then and share with you some slides if I can find them somehow. There we go. Can you see my presentation?
Yes.
Yep, great. All right. All right. So I'm going to start out, as I said, with just saying a word about PICUM. So PICUM, we're celebrating our 20th anniversary this month. We were founded back in 2001. A small group of organizations came together to advocate at the European level for the rights of undocumented people. And we've grown to 160 plus organizations working in more than 30 countries to ensure the rights of undocumented people. And so our vision is really one where human mobility is seen as a normal reality and where human rights are truly applicable and enforced and implemented regardless of a person's migration or resident status. We work according to principles of social justice, anti-racism, and equality. And our aim is really to ensure that undocumented people have a better standard of living and can really access their human rights. And essentially, a big part of what we do and how we work is to gather a broad range of experiences and expertise across the Secretariat, across our network, to create a platform for the engagement of civil society actors, policymakers, and the general public to really advance the realization of undocumented migrants' rights. So we work across a number of different thematic areas. My areas of work focus on healthcare and broader issues around health equity in undocumented people. I also lead our work on access to justice for undocumented people. In addition to that, we work on the rights of undocumented workers and issues around labor migration. We work on issues of housing for undocumented people, areas touching on migration policy, and in particular in relation to immigration detention and deportation. And we work on the rights of undocumented children, families, and youth. So within the Secretariat, we do our own advocacy in addition to supporting our members. And that advocacy is primarily with respect to the European institutions, but also at the global level. And we also support our members in various ways in doing national level advocacy. We develop policy recommendations, we develop resources through research, we also do videos, we produce guidelines, we do a lot of communications work through social media and work with traditional media, also on changing narratives around undocumented migrants. Which we might call awareness raising, but actually is very much around changing the way we think about and approach issues related to irregular migration. So, as I said, our work covers a lot of different areas, but I'm going to focus just for today on health-related issues because I thought that might be of particular interest. But again, in our discussion later on, you're welcome to ask about other aspects of our work or these issues, the situation of undocumented people in Europe. So at the national level, we collaborate with our members and with other partner organizations. We also have relationships with local and regional authorities. At the European level, we work with health associations, health and social justice NGOs that maybe specialize in other areas, but where we can join forces on different issues. With EU agencies such as the ECDC, which is our version of the CDC, and the EU's Agency for Fundamental Rights, as well as the European institutions themselves. We work closely with a number of global bodies, UN bodies, in my case, the World Health Organization, and the whole apparatus around something called the UN Migration Network, which I can say more about, and entities like UNAIDS. And we also work a lot with academics and lawyers. Here are just some of our recent publications in the area of health that include access to healthcare for undocumented people at the local and regional level, sexual and reproductive health rights for undocumented people, data protection issues related to access to social rights, and other resources that we've produced. So in terms of COVID-19, what we've tried to do with our network and through our members and with our partners is to try as best we can to monitor and analyze the different developments that have been happening at the national level in terms of policy change, but also in terms of just the realities of undocumented people and our members who are very often providing services and supports for them in different ways. And we've also issued recommendations. We've done this through media monitoring, doing surveys with our members, having meetings and interviews with our members in national level organizations. And since last December, we've had a specific focus on access to COVID-19 vaccinations for undocumented people. So I wanted to say a word before speaking about how the pandemic has affected undocumented people in Europe, which again, I think will resonate very much with the situation in the United States. I wanted to say a word about where we were before the pandemic. So of course, it was already the situation that undocumented people in Europe, by and large, before the pandemic, had extremely limited access to decent work, decent wages, access to the healthcare system, and to social protection. So the European Union has 27 member states since the exit of the UK. In the vast majority of those member states, undocumented people have very, very, very limited access to healthcare and ability to use health services outside of emergency situations. I should say that that's not true in every country. Belgium, for example, where I live, is an example of a handful of countries that do have legislation that makes it possible for undocumented people to access preventative and curative care under national law. And so where in countries like Belgium and France, for example, there are schemes in place for them to access healthcare, there are unfortunately significant barriers in practice. So even where there's possibilities on paper, there are significant administrative barriers that prevent them very often from accessing those services. And of course, perhaps something again that resonates with the US context is that there is a pervasive fear of authorities because of the risk of deportation, including in accessing healthcare. In Germany, for example, there's specific legislation that requires the public authority that grants undocumented people the piece of paper that allows them to access healthcare. That same public authority has a legal obligation to inform the immigration service when a person attempts to access healthcare. So what has the pandemic changed for undocumented people then? Well, they have, in many instances, faced an increased likelihood of infection. And part of that is related to precarious living conditions because of the factors I mentioned before. Undocumented people very often live in situations of poverty or social exclusion. And so we have in Europe a number of different contexts where this plays out. In countries like Greece, there are effectively camps where people live in very, very poor conditions and close contact. There are informal settlements in countries like Italy and Spain where agricultural workers live again often in very poor conditions. There are people living in immigration detention centers. There are people sleeping rough or living in overcrowded and cramped private accommodation, where obviously it's very difficult to respect social, physical distancing. And sometimes it's very difficult even to access basic hygiene measures like regular running water and so on. And of course, for many undocumented people, they had to keep working. They've had to keep working throughout the pandemic. So while people like me have been teleworking, they had to either continue working in situations of high risk, either in the domestic work sector, in the agricultural sector, transport, hospitality, and so on, or for basic survival, or because they were doing critical work. They were doing work that we continued to need, including delivery of lunches to people who are teleworking, and very often with limited protections. And of course, those who could not continue working had no access to income support or social protection. So in terms of some of the data, the Organization for Economic Cooperation and Development, the OECD, published a paper at the end of last year on the impact of the pandemic on migrants, and concluded that few data are available on this issue, but they do show an overrepresentation of immigrants in the incidence of COVID-19. And so these are some examples of figures from a handful of European countries where we see a disproportionate number of foreigners or migrants bearing the burden of COVID-19 infections. And of course, this is what we know of documented people. It's even harder to get this type of data for undocumented people. And of course, there's the broader climate in terms of the enforcement. At the time, this was more last year, of confinement measures and how this was disproportionately done in ways that targeted particular ethnic minority groups, asylum seekers, migrants, and of course, people who appeared to be migrants, and placed a particular burden on these communities. We saw this also here in Brussels, where even some young people died because they were pursued by police, often from neighborhoods with high concentrations of migrants, where enforcement of confinement measures was much more strict than in other parts of the city. So our work, as I mentioned, is focused in the last year on access to the COVID-19 vaccines for undocumented people. And so we've been doing our best to try to understand and monitor the situation as best we can. So here's a little map of Europe. And we've been trying to give some visibility to what the realities are. We initially looked at what national strategies were saying, what governments were saying in their national strategies about whether they plan to include their undocumented residents in vaccination programs. And then more recently, we've been trying to understand implementation of strategy. So basically the reality in terms of who's able to access the vaccine. And you can see there are a handful of countries in green where we understand from national members and partners that things are actually decent for undocumented people. In several of these countries, there's already legislation in place, as you can see in France and Belgium, to an extent in the Netherlands, right above Belgium, Portugal in the bottom left. There's already some provision for undocumented people in national legislation. And so it's not entirely surprising that they would then be included in the vaccination programs. The countries where you see yellow and green, those are countries where, like Italy and Spain, where the situation varies dramatically from region to region. So while there may be an overall strategy that is inclusive, the reality on the ground is very, very much regionalized. And then we have some countries concentrated in Eastern Europe where there's no access at all to the COVID-19 vaccines if you're an undocumented person. Another thing we've done is we've been publishing blogs based on interviews with national level actors to try to give some insight with a bit more detail to what the situation is in different national contexts in terms of access to the vaccine and different approaches that are being used. So some general trends. There are a number of things that happen at the European level. In the EU, healthcare delivery is not one of them. And so it's not surprising then that we see a patchwork of approaches. We see different countries taking different approaches. And in a way that's entirely to be expected also because their circumstances are different and so on. But at the same time, when it comes to undocumented people, in terms of who's even included in vaccination strategies, we see this same type of patchwork approach. On the one hand, we see countries where there are proactive efforts to actually include undocumented people. We see outreach programs. We see real attempts to work with civil society to develop initiatives in countries like Belgium, Netherlands, and Portugal. We see countries that on paper have inclusive strategies, but where there are really important problems in practice, like in Germany, Italy, and Spain. And we see countries where undocumented people are just completely left out altogether. So I have a few case studies that I have prepared. Let me know, Andreas, if I'm running low on time. I don't have to go through them all. I can maybe just highlight a few. But maybe just briefly, the Netherlands is a country where its national strategy explicitly mentions undocumented people alongside unhoused people as people eligible for the vaccine after other priority groups. And they had a variety of different ways. So they tried to introduce some flexibility to the ways in which undocumented people could access the vaccines, whether they were in homeless shelters, whether they could access them by phones or through a general practitioner. Portugal has a fairly sizable number of undocumented people in its country. It already has a legal framework that allows undocumented people in principle to access healthcare. And while the strategy for vaccination didn't explicitly include them, it was explicit about its universality. And given the background context in Portugal of generally inclusive healthcare, this was understood to include undocumented people. The Ministry of Health created a dedicated registration platform for undocumented people with adapted identification and document requirements, so a lower threshold for registration. And as of June, which is already some months ago, but this was fairly early on in the vaccination program, already 19,000 undocumented people had signed up to the platform with support from NGOs. The United Kingdom is another example of an interesting model. They have been very clear from the outset that the COVID-19 vaccines are available to everyone in the UK, regardless of their migration or resident status, that they're available for free, that there will not be any immigration checks. They've really done a lot of work to publish public guidelines, official guidelines, and to get the word out. And this has really been commended by NGOs. At the same time, there have been challenges because the only prerequisite for getting the vaccine is to register with a general practitioner. But there unfortunately have been many cases of general practitioners essentially routinely turning undocumented people away because of requiring proof that is actually not required by law. And so people not being able to register and then that being a bottleneck to vaccination. There's also, generally speaking, what is termed a hostile environment, which has existed for more than 10 years, where the UK government has progressively put in place measures to actively discourage migrants, including undocumented people, from accessing public services and benefits, and put in place measures that expose people in some instances to immigration control if they do. And of course, in this backdrop, in the context of COVID-19, despite the very proactive measures of the government, there is a residue of fear and mistrust that unfortunately has undermined some efforts to vaccinate undocumented people. I won't say too much about Spain because I already mentioned this, but the main challenge in Spain is just massive regional variation, because the way that health is delivered there is very much under the competence of each regional authority. And so it's very much, if you're an undocumented person in Valencia, you'll have a much easier time than if you're from another region. So Slovakia is a country where we see undocumented people essentially being invisible. And so the national strategy says nothing about them. And NGOs we've spoken to have said they're absolutely not on the radar of the authorities. And part of the challenge there is that undocumented people, of course, the demographics of how they live and their realities in any country are different. So in Spain versus Slovakia, the situation is very different. For example, here in Brussels, many undocumented people are 50% of the homeless population is undocumented. That's not the case in Slovakia. The vast majority of undocumented people in Slovakia are workers coming from neighboring countries that are not part of the European Union, who don't have status, but who are living in accommodation and are put up by their employer, but in very poor conditions. And so if you do outreach to homeless populations, you won't reach them. And so they've just been completely left off the radar. And at the same time, like in many other countries, the registration process is absolutely inaccessible to them, because you have to produce documentation and social insurance cards that they just simply don't have. I think Germany is my last example. So Germany, again, I won't spend too much time on because I mentioned briefly before. But the federal plan doesn't mention undocumented people, but there was a clarification administratively in the spring that they should be included in the strategy if they can prove that they're habitually resident. So that was to avoid tourists being able to benefit from Germany's vaccination program. But of course, for an undocumented person, it can be even difficult to prove habitual residence because you may not have stable accommodation. You may not be able to produce utility bills and the type of thing that many of us would consider quite straightforward. And the broader challenges have to do again with registration and have to do with concerns about immigration control because of this legislation I mentioned before that requires reporting to the Immigration Service. Now, I mentioned there is good news, which I'll come back to briefly at the very end. There are examples of countries, of initiatives that are working quite well. There are those green colors on the map. And there's a lot at the global level that has been done to really press for equitable approaches to the vaccine. So we know that vaccine equity is a huge issue globally. That's a whole other webinar. But what we're focusing on also is vaccine equity even within the European context. And the international community has been very, very strong on pushing for this. That includes the Committee on Bioethics, which is part of the Council of Europe, an international body. That includes joint guidance from the UN Committee on Migrant Workers, and also guidance from the UN Special Rapporteur on the Right to Health and on the rights of migrants. We also have publications from the World Health Organization that have been pressing for vaccine equity and providing specific guidance to member states on how to achieve this. And at the European level, there was a publication in June from the ECDC on specific strategies for reducing COVID-19 transmission and strengthening vaccine uptake among migrant populations. And there has been some interest in vaccine equity issues from the European Commission, although we've been really pushing them to be much more vocal on these issues. So we're approaching the end now of my presentation. Just to summarize the main challenges that we've been seeing, one critical challenge, and it's not always intentional, is administrative barriers. Systems that are set up for people who have national identity numbers, who have social insurance numbers, that exclude everyone who doesn't have those things. That is a huge barrier for people accessing the vaccine. Another enormous barrier is just lack of trust and lack of guarantees about how people's personal data is being safeguarded against possible use for immigration control. There's just been a lack of access to accessible and reliable information in people's own languages about what their rights are, about how to access the vaccine, about the vaccines themselves, about their safety. There's been lack of clarity about policies and procedures, inconsistent implementation within countries, within regions. 2 doses presents a challenge for people with precarious living conditions. And there's been honestly a lack of proactive and meaningful engagement with affected communities and community-based organizations. At the same time, we've seen examples of promising practices in countries like Belgium, in Portugal, in France, in the Netherlands, in Norway, of proactive measures to address existing legal and other barriers to access, of efforts to really work in a meaningful way with community-based organizations to develop measures that actually work, to develop clear guidelines on implementation, to show and to articulate clearly their commitment that personal data will not be reused in ways that can undermine public health goals and create mistrust. Multilingual communication campaigns and really targeted outreach to communities to address vaccine hesitancy and to explain how they can access the vaccine. So there is good news in Europe. We are entering a new phase now, which I can maybe talk a little bit about in the discussion, where the major vaccinations programs are primarily reaching their end, and there's more targeted measures that are now being taken. And so that's something we're looking at a little bit more now. But this is, generally speaking, the lay of the land. So I hope that's been helpful. But the 3 main takeaways are essentially that we just have more visibility in the context of the pandemic to a lot of things we know already in terms of health inequalities and social inequalities that are linked to a person's irregular migration status and social exclusion. We see really good examples of promising practices, but inconsistencies undermine that. And finally, we need to understand that access to the vaccine is really one piece of this, but we have to situate this in a broader context of the need to press for improved access to health systems more generally for undocumented people, and addressing all of those factors that undermine their health by limiting their ability to earn decent wages, access decent housing, and criminalization of people based on their migration status. So that's it for me. That's the end of my presentation. So I realize I blew through quite a lot of information. So I'm very happy to hear from you and to take your questions.
Thank you, Alyna. But before we get to the question period, is there one specific project or example of success that PICUM can point to that it has been involved in alleviating some of these situations?
Honestly, I think the strongest example we've heard of is Belgium. We have repeatedly heard examples of Belgium really being out in front of this issue. And of course, PICUM, we're not on the ground per se, but we have members very active here in different parts of the country. And I think what's really notable about the Belgian example is that from the earliest days of the vaccination program, they were responsive to NGOs that reach out to them to express their concerns about access issues, to really develop protocols together with NGOs, with community-based organizations, to really design their entire vaccination program around addressing barriers to accessibility. I mean, this isn't specifically for undocumented people, but just here in Brussels, there were 10 vaccination centers set up in the city. And just something that they did is try to make sure that anyone in the city could access those vaccination centers within 15 minutes on public transit. That's hugely important. And for an undocumented person as well. And they also made sure that once you've registered for the vaccine, and it was a low threshold to register in terms of documentation, you would get a code that would allow you to travel for free on public transit. Again, it's not specifically for undocumented people, but for undocumented people, that's huge, that you don't have to worry about an identity check on the bus or on the metro because you have a ticket to go to get your vaccine. So things weren't perfect, they're not perfect, but I think Brussels, in particular, in Belgium in general, has really stood out as being very, very out in front of access issues for undocumented people, for lots of socially excluded groups, people facing homelessness, sex workers, all kinds of groups where there are particular barriers and challenges, and where
Oh, we lost Andreas. Did we lose her, or is that us, or is that our?
It seems like she dropped for now. We have to wait until she comes back.
All right. Well, while we're waiting for that, I want to certainly appreciate Ms. Sakari. Thank you so much for being here with us from the Rotary Club of Cairo, Egypt, and Frank Bannister from Ireland. Tom, also, you said you. Yeah. Go ahead. Go ahead, Andres.
No, I just, I think you're introducing Tom, right? He wanted to introduce this.
Yes, Tom, you wanted to introduce a new person. Would you please be so kind to do so now?
Yes, thank you very much, President Gerard. Yes, it's with great honor. We have a new member who joined the club this week. She is, her name is Sister Marie of the Cross, and she's a clergy of Fraternity Notre Dame that our club has been working with for the last 25 years. And she runs the soup kitchen in Harlem on 117th Street and First Avenue. And our club does a lot of work with that soup kitchen. It provides a house for Santa to come visit during the Christmas time. Before the COVID, they used to serve 350 meals a day to the needy in the neighborhood. And they're really, I'm just so pleased that she was able to become a member of our club. They're the Fraternity Notre Dame is a very conservative Christian missionary, French missionary group. They say mass in Latin, and the nuns still wear traditional gowns as you may remember from in Catholic school from years ago. But they do terrific work. They have missions all over the world, 6 or 7 in the United States, in some of the poorest areas of our country. I've been to several of them, and she has one in Harlem, and they have a mission in Haiti, Mongolia. They had something in Nigeria or something. I'm not sure if they still have that, but she's very good. Unfortunately, the sisters don't use smartphones. They don't use the internet. They're that conservative. So I believe she called in. So I don't know, Sister Marie. Of course, can you hear me? Are you on the line? She signed in. Her English is a little limited.
All right. Well, Tom,
but
I think
she's calling in. Yes.
I think Alyna, are you back with us, Alyna? Yes, she is. Well, Tom, I thank you for introducing her. I know you were very involved in her becoming a member personally, and we appreciate that. And for those of you who don't know, Rotary Club of New York has been involved with these sisters up in East Harlem for a number of years. Last summer, in the height of when COVID, the crisis originated, we were involved in handing out over 50,000 packages of fresh produce, foods, on 116th Street, 145th Street in Harlem, in the Bronx. So we're very much involved with them. Thanks in no small measure to Tom. We're very grateful for that. And we will continue to have projects with them, serving all of those people in that part of New York City. And you'll hear more about this in the very near future. Thank you, Tom. Alyna, you're back with us. We lost you for a moment.
Yes, everyone froze.
Anyway.
So I guess it was probably me who froze. Yeah.
Okay, thank you. I also want to introduce Farouk Kanatar, Rotary Club of Adana in Turkey. You with us?
Yes.
Welcome, sir. Glad to have you with us today.
Thank you very much, President. It's been an honor to join your meeting right now. And Adana has the same time, but because of the time zone, I cannot join my class meeting. So since I'm in New York, so that's much better to join
Fantastic.
you. As a matter of fact, the past president John also recommended to join your meetings.
Good.
And I'm gonna do my best to join your meetings weekly if I have to, or whenever you have the chance to meet face to face. That'll be also my pleasure to meet you all.
Well, the third Wednesday of every month, we have our breakfast, our 9 a.m. breakfast at the UN. And that's Malika Abru, who is in charge of handling those. So that's 9 a.m. here in New York. So that would be doable, certainly, to anyone in Europe or, Northern Africa, Middle East. It'll be later on in the day, but within reason. So, probably late afternoon there. Okay, Alyna, we're back to you. It would seem to me, Alyna, that just from self-interest, why would any government like Poland, Hungary, especially, I'm surprised, the Czech Republic, Bulgaria, Slovakia, denying vaccine to undocumented immigrants poses a very serious threat to everyone else in the rest of that country. How do they address that issue of just from the pure viewpoint of self-interest? It's a physical health threat to all of us.
I mean, that's very much what you would think, isn't it? We make that argument, and public health authorities make that argument, that the universal implementation of vaccination is in everyone's interest. Of course, we have to be very careful because we don't want to insinuate that migrants themselves are a specific risk. But of course, excluding them is extremely problematic. So it's very hard to understand the rationale. But again, in many of these countries, in the majority of these countries, they already have virtually no access to healthcare. So this is very much a continuation of that approach. And I mean, I think it's interesting when we talk to some of the organizations nationally, it seems as if they believe that once the initial kind of official vaccination program reaches its end, that then there may be more scope for them to make the case to vaccinate remaining people who've been left out. So in a sense, it's a kind of nationalism where it's like we do the citizens first, and then afterwards we reach out to the rest. So it could be that there's also that dimension of it. There initially, in the very early days of vaccination rollout, there were concerns about supply issues in the European Union. So that also made it easier to justify that we're going to vaccinate our people first, quote unquote. So I think that may have also been a dimension. There's also a sense overall, unfortunately, in the whole thinking in some countries about access to services, access to benefits, access to healthcare, that if you allow people to have these things, if you give them access, then that itself kind of encourages them to come and encourages them to stay. But of course, that's not at all how it works. And of course, that was the rationale behind the UK's hostile environment. And what it has succeeded in doing is not deterring migration, because people don't migrate for those reasons. It just pushes people further and further into exclusion. But there tends to be this mentality that if we grant access, that will encourage certain types of migration. But that again, that is just not why people migrate. And maybe the last point is just, I think in some countries, my sense in Slovakia, for example, is that there is really just denial that there are undocumented people. We've heard that also in other countries. In Northern Europe, for example, we don't have this. This isn't an issue for us. Also, maybe there's less visibility because it's not, for example, that there's large settlements like in Italy, or camps like in Greece, or large numbers in city centers. It's mainly, as I said, for example, in Slovakia, seasonal workers living in accommodation outside of large city centers. So it's easier to just kind of not think about it. So I think there are a variety of reasons, none of which answer your question about, which is that, it's not an answer to why it makes sense, because it doesn't make sense. But I think those are some of the rationales that we hear from national organizations that would be consistent with what we've seen more generally on the issue.
So would you then think that the primary motivation for denial of these services might simply be xenophobia?
I think that's part of it. And I should say that, that is definitely a concern in some countries. Sometimes the exclusion is more hidden, though. It's not per se that a national strategy says they cannot get the vaccine. It's that in every step to get the vaccine, there's no way for them to just do it in practice. So there's been no accommodation at all in the process. And that may or may not be xenophobia, but it certainly is a complete inattention and a complete failure to respond and address the realities and the needs of people who are excluded, including based on being undocumented. So it may be explicitly that, but I think very often it's a bit more, it's tied up often in the realities of how people access it and the absence of any effort to accommodate and address their issues.
Just to speak for, and I guess not a defense, but certainly to be grateful that we do this here in New York City. New York City probably has the most diverse population of any place in the world. I mean, if anyone were to get on the number 7 train, the subway to Queens, literally, you will meet someone from every country in Latin America. You'll hear every country from Latin America. You'll hear people from Southern Asia, from Eastern Asia. And New York City dealt with the issue of, one of the ways we've dealt with the issue of COVID vaccine is to literally encourage people to get the vaccine to the point where New York City compensates everyone with $100 simply to get the vaccine. No questions asked. No one asked where you're from. That's not the issue. The issue is we've got to protect the population. And the best way to do that, is simply to vaccinate everyone. And so literally public funding is used to encourage people to get the vaccine. And it has been successful to a great degree here in New York. And that's why it would seem to me counterproductive in any other country to discourage people from getting the vaccine, because you're simply endangering yourself and your family by not doing that. So, but I've spoken enough. Are there any other questions from other people? Let's see.
Frank Bannister.
Frank, yes.
Hello,
Frank
John.
Bannister.
I was just thinking when you're talking about New York being the most diverse city in the world, and I think you're probably correct, but is it possible to walk from one end of Grafton Street, the main shopping street in Dublin, to another without hearing English spoken? Which is quite remarkable, especially for somebody like me that grew up in a country that, you never saw a foreigner until I was about the age of 12. I have just a comment on a question going back to xenophobia. I think it might not just be so much fear of foreigners as such as a feeling that somebody else is jumping the queue. Why should a immigrant get housing when Irish people or Americans or whoever, Dutch or Belgians, can't get housing? And that isn't necessarily xenophobia. That's just a question of, hey, we look after our own first. But my question is this, and it comes back to Belgium. And this is a slightly cynical question, but as I recall, for quite a long time, Belgium was right at the top of the table of OECD countries for having the worst infection rate and the greatest number of infections. And it was way out. It was out on its own for a long time. To what extent do you think this might have been a driving factor in encouraging the Belgian government to make COVID vaccines available to everybody, no matter who they were?
Would you like me to answer that one now? Or shall we take a few questions as you like?
No.
Go ahead. Okay. Maybe I'll answer your second question first. I'm not an epidemiologist, but my understanding is actually that there was some confusion in terms of the levels of COVID infection, or at least if not confusion, then a bit of lack of clarity, because countries were not counting in the same way. And so when we were trying to compare different countries to each other, we weren't necessarily comparing apples and apples. And my understanding is that actually Belgium's numbers were much, much higher because Belgium was actually counting deaths to COVID that occurred in care homes. Whereas, as far as I know, virtually no other European country, or at least very few others, were actually doing that. And so that meant that Belgium was reporting much, much higher rates than, or numbers than other countries. So I'm not aware that there was a kind of stronger impetus than for other countries for really achieving universal vaccine coverage. You may recall that actually Italy is one of the European countries that was hit the hardest at the outset of the pandemic. And Italy really, in many ways also has, there are shortcomings as well, but they've had a fairly inclusive vaccination program, again, with regional differences. But I'm not aware that was a particular imperative in the context of Belgium. Although, of course, the rates were high here. There was a lot of concern about the rates. But again, I think Belgium has a long history of a fairly inclusive social model and health model. So again, it's quite consistent, I think, with that. I should say that there's quite some good practice also from Ireland that I'm happy to talk about if anybody's interested. In terms of xenophobia and your comment about jumping the queue, I think that's a fair point. At the same time, I think we need to look a bit carefully at the whole jumping the queue kind of frame, because oftentimes that's a frame that's applied to undocumented people in general, that they don't follow the rules, that they're here illegitimately, that there's a sense of not kind of deserving to access certain things because they haven't followed the rules. Whereas I think there's a much bigger story about those rules and the opportunity people have. And very, very often in many countries, undocumented people have been living in those countries for very, very, very long time. So I think that's a fair point, and it's understandable, but at the same time, I think it can be a little bit it can be a little bit nuanced, and can sometimes feed into notions of xenophobia, nationalism in terms of who's deserving, and who merits being included.
I may have mentioned this to you, Frank, in the past, but I was somewhat surprised when I learned a few years ago that what was the second most spoken language in Ireland after English? I just assumed it was Gaelic. I didn't realize it was Polish.
Oh yes, Polish, definitely. In fact, the Polish community is even after COVID is very substantial in Ireland at the moment. I think the current figure is 18% of people living in Ireland at the moment were not born there. Wow. It's about that order of magnitude. As we're catching up with the United States.
Yeah, well, yeah. I will just mention here, I don't know if you know this, Alyna, but in the United States here, if when I'm sitting on the bench hearing cases, very often the person who is being brought by one of the city agencies it doesn't speak English well at all. It's a second language, not the first language, and they may have difficulty understanding. So last week, I actually had to find a Tibetan translator. There's a whole population of people from Nepal and Tibet who have emigrated to New York City legally, and they're here, and so we go out of our way to try to accommodate them. I finally did get a translator for Tibetan, but it's kind of an unusual thing. All right, anyone else? Any kind of a questions?
Yes.
Malika Abru.
Yes, I think Alyna answered my question or in part, but the definition of pandemic, I think, is not well understood. When you have a pandemic, you have to go after everybody and get them vaccinated, no matter what. Are they afraid that vaccination services would be an entry point for other services that the government want to deny them? Is this a fear? Or because if they don't eradicate, eradication is everybody. It's not just, pick and choose. So Alyna, have they understood the definition of pandemic? And the Polish people who are getting vaccinated in Ireland, back in their country, they don't vaccinate people like them who are refugees or undocumented, or that globally it doesn't make sense.
No, I completely agree with you. And of course, the WHO's mantra has been no one is safe until everybody's safe. And
absolutely, that's pandemic.
No, absolutely. So I'm afraid we don't have a lot of insight on the reasons for exclusion. And I think they vary by country. And we just have kind of our suppositions based on kind of previous action in a broader context, but we don't have a lot of insight on what's driving, like concretely what's driving. As you say, what seems to be not a very rational approach.
It's not a rational approach. And at this rate, we will never eradicate this virus. It has been politicized and in a very pernicious way that really impede progress towards eradication. And it's very sad.
Yeah, I think there is there's also the issue about information. I think all of us know that there's vaccine hesitancy in certain corners of the population, and that's true also among migrants and undocumented people as well. And there's no counter information oftentimes for them. There's no other trusted, reliable source of information in their language or that's easily accessible if they can't just get online to the National Health website. And so again, the good examples we've seen are really, and again, I know this exists in the US because I've heard of you go into communities and you work with them directly and you bring them information. And of course, that hesitancy for migrants also includes just a broad lack of trust because they have had experience with authorities that has been really negative, and a prioritization of deportation over other factors. So that compounds things, but information is a huge challenge, but also opportunity to address some of the barriers as well.
Mhm. You know, Malika Brew has been very, she's chair of the UN Breakfast Committee, and she has a lifetime experience working with UNICEF, especially in Africa. So
Thank you.
She knows of what she's speaking. And it doesn't make sense. I mean, I'm giving away my age, but I can remember as a very young child,
Polio.
the whole issue of polio. And I remember losing a good friend of mine. I don't know, we were 8, 9 years old, and he died in an iron lung from polio. And it was, you know, the greatest fear that you would get it and you're going to die from it. And it's not very pleasant. And so when the vaccine came out, there was absolutely no, I can't think of any politician who would dare have gotten up and said anything about, well, this is why you shouldn't take the vaccine. I mean, it was a gift from God. This is life. You take it, and that's the end of it. And everyone breathed a big sigh of relief. This is so different today. I'm sorry, Malika, I cut you off.
No, it's okay. What happened since? Because vaccination is very important. Everybody has been vaccinated against polio now. Why resistance against another terrible disease that can kill you?
Yes.
Children are dead now in the US.
Yes.
Children are dying.
Yes. President Gerard, can I?
Yes, Tom, go ahead.
Can I chime in, President? Yes.
Of course.
I think that's really true. I'm really glad you brought it into the polio issue. That's something that Rotarians know a lot about. And I was wondering, I want to thank our guest speaker for the wonderful talk, but I was wondering how she thinks Rotary could help. Could we help somehow in this vaccine distribution? Because from what I read, there's plenty of vaccine available, but you get the vaccine to the airport, but it's hard to get from the airport to the villages in Africa and parts of Asia and things. And that's what Rotary is good at. Unfortunately, I'm not smart enough to figure out how Rotary can do it, but I was just wondering if our guest speaker had any ideas that she knew about the Rotary Polio Plus program, and how could Rotary help some way in this solving this problem? Because the polio vaccine is just droplets. You don't have to give an injection, so you need a skilled person to give the injection, I assume. But with the droplets, anyone could distribute the droplets to children. So I was just wondering what our guest speaker would think about that.
Well, Rotary does things through local NGOs. They cannot do it themselves. They are not specialized enough to do it. Or through UNICEF for health, for the health programs. So this polio vaccine has been administered by UNICEF, actually. And it's a vast network of health centers that they encourage, and they put together, actually, with local personnel. So that's how Rotary functions. That's how the Rotary program has been for polio eradication has been conducted through UNICEF.
I can mention one thing, Tom, going along with what Alyna has presented to us today. One of our past Rotary Club of New York presidents and I, both attorneys, met with a group of attorneys from the New York State Bar Association a few weeks ago, about a month ago now, and formed a new subcommittee where these attorneys, they're immigration attorneys, will be providing pro bono services to do the paperwork necessary with the State Department to get Afghan refugees into the United States. I've been working with a group of people, some of whom are Rotarians, most who are not, though. We brought in so far between 400 and 500 people from Afghanistan in the past couple of months. And so this is one instance of how Rotarians get involved, not as Rotarians, but as Malika said, bringing services and resources to other groups which are able to do what Rotary itself cannot do.
To implement, to do the implementation.
Yes. Precisely.
President
Yes.
Gerard, I just want to mention one thing. You'll see I'm in my car again. I know you're always concerned that I've been living in my car every time I call you, but I assure you, I've been able to pay my mortgage over this terrible crisis and things. So
That's
I do have a house to live in. Okay.
That's reassuring. Thank you, Alyna. If I thank you very much, Alyna. If I may ask you a question, has PICUM dealt with the issue of sex trafficking, sex workers?
Well, those, yes. So I guess in which aspect?
Well, I mean, we know that young girls, women have been transported all around from different parts of the world. I'm not even going to mention countries because I don't know if there's any country that's immune from this. Certainly not New York City. It's an issue here, definitely, where young women are brought against their will and almost enslaved. Well, maybe even you can say in a way they are enslaved to be sex workers here. And this is a question again of undocumented immigration. It's an issue. It's a health risk, obviously. Any suggestions how we deal with this?
Well, that's just a small question. Just
a small one, yes.
All right.
You can give it a minute or two, so we can come up with an answer. Yes.
Well, I mean, I guess maybe I'll just start. I think there's some important, again, coming back to nuance, maybe. So we work on issues of exploitation. We work on issues of exploitation in the labor context mainly. And we don't specifically work on, for example, human trafficking, issues of trafficking in human beings, which includes trafficking for the purposes of sexual exploitation. It can also include trafficking for the purpose of, in the labor context as well, different forms of slavery, as you've said. We don't work on that per se, but we have several members who do, and it's a very big priority for the European Union. It's a very big issue in Europe. At the same time, we work on the rights of sex workers. So we see a really important difference between forms of exploitation and including trafficking, which is and slavery, which are the very egregious and severe forms of exploitation, and sex work. And so if it involves children, by definition, it's exploitative. But sex work, we actually have in our network organizations that advocate for the rights of sex workers. Many sex workers in Europe are undocumented, and they are people who sell sex in different ways as a way to earn money for different reasons, including because of other avenues being closed to them because they're undocumented. So, but for other reasons as well. And that is distinct from people who are coerced into any form of selling sex. So, so that's, I think, an important distinction. And again, we see important overlaps with the ways that criminal laws in some parts of Europe can create criminal penalties for sex work or aspects of sex work that actually make undocumented people who practice that less safe and more exposed to harm. But at the same time, that's very different from people in situations of exploitation and trafficking, where they are coerced and abused and manipulated to engage in acts that they don't consent to. And then there's a very strong legal framework at the EU level for that, and we have members that work on those issues. So it's it's kind of two different channels of our work. And so how to address it? Gosh, I think one important thing is to understand that difference and to recognize that difference and to make sure that we're not conflating those things, because what we see is that sometimes in an effort to try to bring more protection for victims of sexual exploitation, there can be a push to criminalize sex work and to further demonize people who are engaged in different forms of sex work. Which of course, many people may or may not disapprove of, but that criminalized framework oftentimes actually undermines their rights and their safety and exposes them more to violence and mistreatment and actually makes them more likely to be exploited. So I think that's already one important thing. But I think that's a whole other conversation. I'd be very happy to have one of our members working on trafficking come and speak to you, because it's a really big and important issue.
Yeah, I think, yeah. Andreas, I think we should pursue that. Thank you, because that is an issue here in New York, and no one denies that it exists here, but it's still criminalized. And I'm not arguing for or against it. I'm simply saying it as a statement of fact. And you're correct that people who are abused one way find themselves abused from the other side as well, and so they're almost enslaved and entrapped in it. And it's a pernicious thing. Before we leave today, I just want to make mention, our members have been sent, Andreas has sent everyone a copy of the film produced by Olivier Puntos, who was a guest of ours a few months ago on 9/11. I suggest very strongly that you look at it. Even though, I have a lot of, unfortunately, experience with 9/11, this really hit home with me. And I think it answers some of the questions that we have as to why things have become so politicized in this country. Let us not forget that 9/11 was the direct cause of what happened in Iraq and Syria, Afghanistan, perhaps even Yemen. And they are and we are all living with the effects of this. And I think it's something that has really affected the psyche. At least I can say the psyche of Americans, New Yorkers especially. And I welcome everyone. If you didn't get it, please send an email to Andreas. He's told me he has sent it to everyone. Take a look at it. I think you'll enjoy it very much. Malika, before we leave, is there something you want to mention about the UN breakfast next week?
Yes, it's all set, and we're going to have a very good speaker from UNICEF. As you know, UNICEF has launched its annual report, its report on the state of the world's children for 2021. And the main theme is mental health. The COVID-19 epidemics has revealed that it has really affected many children all over the world, and here also.
Of course. All right, thank you. We'll look forward to that. That's 9 o'clock next Wednesday, correct?
9 o'clock, that's correct.
9 a.m. 9 a.m.
9 a.m. And the lecturer will be Paloma. She's the director of the Department of Communications in UNICEF.
Thank you so very much. Alyna, thank you very much for your time today.
Thank you.
I think it was, very valuable for us to understand this issue. It affects all of us, certainly. I mean, again, when I sit down on the subway, I have no idea whom I'm sitting next to. This person could have just gotten off a plane at JFK from country X an hour ago. I have no idea. And it's an issue that we have to think of as a universal issue, and unfortunately we don't. Thank you so much for being with us today. Thank everyone for your participation. Please check out your emails. A lot of exciting things we're planning for the next few months, and we'll get them to you just as soon as we can. Good to see a lot of you today. Michael, haven't spoken to you for a while. Glad to see you. Francis, Limbe, a whole bunch of you folks. Thank you for joining us today. Andreas, do you want to close us out?
I have nothing more to add, but as President Gerard said, I put that video clip also into the chat room. So if you want to copy paste it quickly before we close, it is definitely a film worth watching. So That said, we see you next
That's
Wednesday.
why we keep you, Andreas. You're the best. Thank you.
Thank you. Thank you very much.
Thank you, everyone. Please stay safe. Alyna, thank you.
Thank you very much. Bye-bye, everyone.
Thank you, Alyna.
Thank you.
Thank you.